Hello, friends, and welcome to Activate and Thrive and to our Thriving Thursday chat. We run these periodically on different topics related to staying healthy, active, and thriving in many different ways in life. So we're here live on Facebook on Thursday, June 23rd, 2022. And we also share this to Instagram and to YouTube. So whatever platform you're watching from, and whether you're live or watching later, welcome. We're so happy that you're here today. My name is Dawn.
And I'm Mia. And our guest today is our cousin.
That's right.
Dr. Gina Firman Nikkel. And I'm just going to read her bio because there's a lot to it. Gina is the executive director of the Association of Oregon Counties and an associate clinical professor in psychiatry at Oregon Health and Sciences University. She formerly served as the president and CEO of the Foundation for Excellence in Mental Health Care, the executive director of the Association of Oregon Counties Mental Health Programs, and has worked extensively in mental health and addictions policies, leadership and management, healthcare financing, development, and political advocacy. As a community mental health therapist, adolescent program director, and clinical supervisor, she gained experience in all aspects of community mental health, including prevention, civil commitment, compliance review, and crisis management. So there's a lot there. So Gina, welcome. We're so happy to have you with us. Can you just share with our audience and tell a little bit about how you got started in this field of mental health and why?
So Mia, like you, I was trained in something completely different. You were trained as a singer. I was, my first degrees were in theater and dance, and I love that. And at some point, I thought I probably need to do something to support myself a little better. I loved being a gypsy dancer, but you know that I wanted to do something else. And somebody said, "You're such a good listener. You would make a good counselor, a good therapist." And I just went, yeah, okay. So I went and got my master's degree in counseling. And that started me learning about the field of psychiatry, of psychology, of wellness. And with that, I also have a degree in herbology because I also wanted to look at the Western philosophy, for lack of a better word, the Eastern philosophy. How are we the best, well, whole person? So I wanted to look at what Western medicine had to offer and the rest of the world.
Wonderful.
Oh, that's great.
Well,
So,
go ahead.
Okay, I'll go ahead. So in our work in health and wellness, we're helping people learn about how to reduce certain things in the body, like something called oxidative stress, which is pretty much linked to every health issue you can name. So we activate our brain and our body to heal naturally. And we believe we really need to be advocates for our own health. And turning to Western medicine, though, Western medicine absolutely has its place for sure. But can you speak a little bit to the problems that can arise from long-term prescription drugs?
Sure. So one of the things that's very interesting is 1 out of 5 people in the United States are on a psychotropic medication or a prescription for something, maybe as simple as anxiety or ADHD, to a medication for schizophrenia, which is in the DSM-3, that's the diagnostic manual. But in reality, schizophrenia is just merely a description of a set of symptoms. It's not really a disease. And so Western medicine is really disease, looking at what the disease is and then what the cure is for it. So we've been trained that if we're not feeling mentally well, ask your doctor for a pill. And there are people that have a mental illness that do need help. But we've been trained that that's 1 in 5, right? Or everybody. And that's not necessarily so. Mental health challenges can be derived from not getting enough sleep, not eating healthy, not getting enough exercise, having a life filled with trauma. And so there's a lot to unpack here to decide whether you need to go the Western medicine route or whether you just need to see a therapist or whether you need to get a mentor and be healthy. A lot of people don't get enough vitamin D. Maybe they don't get enough vitamin, the B sector or enough C's. It's like an onion and you have to unpeel. And so before you think that you have a mental health challenge, you have to take a look at how you were raised, who you surround yourself with. Have you had a trauma in your life? And look at the healthy foundations. Do you have a spiritual practice? And I'm not talking about one particular spiritual entity. I'm talking about a healthy attachment to your spirit.
Mm-hmm.
But do people do that though? That you say you need to look at these things. How many people are really stepping back and doing that first look in before they just go to the doctor?
Sure. So many people just go to the doctor first. They call their doctor, and not all, but most doctors are trained to prescribe medication. That's what they do. That's what they're trained to do. 40 years ago, we were trained that mental illness is a chemical imbalance. We've since learned that that is not true. It's much more complicated than that. Europe is about 20 years ahead of us on the thinking, and other countries are 5,000 years ahead of us. And so it's really a matter of having faith in yourself and going, aha, I've been placed on this medication, or I'm fearful of going on this medication. Let me take a look at what else is out there. And you really have to be cognizant because there's a lot of snake oil salesmen out there, etc. There's, this is the magic bullet. This is the magic bullet. And people really have to sit back and take a look at what do I do to support my mental health. And again, sleeping, eating, being around the right people, going to a therapist to look at your trauma issues. But luckily, right now, we live in a world where people are taking a look at things like oxidative stress. And there are a few companies there that are completely ethical and really take a look at the science of what works. And it's natural supplements that help support your body into what you may not have. And so all the above. It can't be one thing or another. And you need to learn to trust yourself. And that's a process if you haven't been taught those skills.
Yeah. Well, when you mentioned Europe and other countries that are years ahead of us, interestingly enough, since the Industrial Revolution, there have been about 85,000 chemicals introduced into our environment. And would you venture to guess how many the United States has banned since that time? 11.
Yeah, I was going to say not very
Not
many.
very much, right? And so we're
most,
just, yeah, go ahead.
most of those chemicals were created to help us, right? But then now fast forward, what we've learned is they're very toxic and they cause the things that inhibit growth in people, cause cancer, cause really traumatic health issues. and so now we've had to uh, dial it back and take a look at, the heavy metals that are in our system. And luckily, there are natural products and natural resources to us that can help you detoxify your system, etc. But it really takes, we need to be lifelong learners and not
Yes.
just take what we're told.
Yes.
If you
As
remember, there was a company that was, I think their slogan was a better living through chemistry. And that was true at the time of the Industrial Revolution, etc. We thought this was going to help make our lives better. And in some ways it did on a few things, but on a whole lot more, it toxified the system. And now we're paying the price and learning what we need to do.
Right.
Yes. And we have to learn because we're living in such a toxic environment. Our soil is depleted. We have to drink more water. I mean, they can be simple steps like that. But, Hippocrates says, physician, heal thyself. And we do have to take matters into our own hands. We can't just turn it all over to our doctor.
And so I see the medical system both rooted in that medical model of ways of doing things. And then I see a whole new class of doctors and therapists and natural practitioners that are starting the aha moments.
Yeah.
And so learn, get a mentor. Obviously there are so many there are so many things that can be additive to your life. So I have a friend named Sheila Hamilton whose husband completed suicide many years ago, and she spends her life as a broadcaster on a podcast called Beyond Well, and she brings experts in to talk about mental health. There are things that you can listen to and people that you can be around that support your health and support the positivity in your life. That's like the first step, is the positivity. And I know a doctor that has been in the field for 50 years, and she finally turned around and wrote a book called The Better Brain, Dr. Bonnie Kaplan, because she was so distressed about the very basics of not good nutrition. People don't realize when you don't eat well or you don't have the right combination of nutrition, that can affect your mental health.
Yeah.
So things like that.
Right. So, we titled this chat today, and this title came from you, Taking Care of Our Own Mental Health. And we've, of course, been talking about that here. How do we know, like, mental health issues sometimes don't arise until later, and you might think you're fine. How, like, what can we be doing? And again, you've already expounded on some things we can be doing, but should we be more heads up about this? We all want to be healthy, but do we think about our mental health enough in the earlier days when everything seems fine? And what can we be doing to up our awareness of that? And what kinds of things can we be doing to help our bodies and brains function? I'm sure helping them function optimally now has a big impact later on our mental health and eating right and all that kind of thing. My question sounds a little scattered. You know what I'm getting at?
What is your question?
I do know what your question is. And of course, we all think when we're doing well and we look at somebody that's having a mental health crisis, we think, oh, that poor person, will pray for you, or will, hand you a card to somebody to go to. And the best time to think about your mental health is when you're not in crisis, right?
Right.
But there are a number of things you can do. And of course, we've already talked about a spiritual practice, eating healthy, drinking plenty of water, getting sleep. But we also live in a society where as you age, it's hard to get that sleep. So there are companies that have products that help with oxidative stress, because that's one of the issues. There's companies that have products that put natural tryptophan, and amino acids in products where you take a chew. It's like having a glass of milk, or why you get sleepy after a turkey dinner at Thanksgiving. Uh, and people don't think about some of those simple things that we have, right there. So the best thing is to make a plan for yourself. Write it down. It's always interesting to me when people keep a journal of what they eat and what they drink for a week. They sometimes they don't realize how bad they eat, or maybe how good they eat. Uh, Also, a gratitude journal can help on a daily basis. So you can see, boy, I've been really thankful this week, and this week I'm not thankful at all. The other piece that I want to mention is that we're humans. We live in human society. Life is not always going to go well. So, for instance, when you have a death in the family, or a sickness, or something, uh, you will be going along great, and then you have a 180 turn due to X, just because we're human and we live in this society. You need to have a plan, and you need to be thinking about this all along, and you need to have support. Again, mentors helping you take a look at your healthcare routine, or some people have a best friend to talk to. They don't always need a therapist. Uh, what what is healthy in your life? You know, for you, Mia, it's singing. For you, Dawn, it's playing an instrument. You've been blessed with making a living at your passion. How many people get to do that? For me, dancing is my passion, even though I'm in the mental health field. But you two have been lucky enough, and I've also done the same, to find mentors, and a few companies that are at the center of taking a look at building products that are not chemical products. They've done science-based research to show how we support our health. And when you have a good health level, because you're taking, and this is oversimplifying, you're taking something for oxidative stress, or you're taking something to help build your vitamin D, or your B, or whatever it is, you can, everybody can go to the doctor and ask for a blood panel, and you can go to a functional medicine doctor, you can go to a naturopath, you can go to somebody that will help you read your blood screen and say, oh, you're down on this. Did you know you have this? There are ethical companies now that take a look at research and design things to help you build up your health. And that helps you fight mental health challenges as you age and as the world turns.
Yeah. Oh, that's so important because, we have to be preventative about our health, whether it's mentally, physically. We have to get outside. We have to move our bodies. We're meant to, be in nature. And, yes, we actually have a brain drink that is firing up our neurotransmitters on all cylinders. And it's natural. It's not these monsters or Red Bulls that people run to get more energy, but it's actually giving us positive mood and focus and mental clarity. And it's filled with B vitamins, as you mentioned, and quercetin and L-theanine and New Zealand pine bark, but really helping people to feel better, happier, healthier. And you experience it pretty instantaneously. And so it's so much better, isn't it, to choose something natural.
It's important to make a whole plan for yourself. If you're not sleeping, find out why. Don't take, I mean, there's pharmaceuticals that a doctor will give you to help you sleep, but what you don't realize is some can be highly addictive, some can help. Do not stay, if you're given a medication, do not stay on it for a long period of time. depending on your, diagnosis. I don't want to
Right.
undermine what works for people, uh, but be aware that we've been given a line of the magic pill and the magic bullet, and we need to build our health, have a plan for all areas of our life. Now, with that said, I do want to say that people are born into sometimes having some really terrible things happen to them, and they become addicts or X or etc. And there are really great doctors, addictionologists to help with that. I mean, we are talking about a complicated world, but one of the things you can do in this complicated world is make sure that you have good nutrition, good sleep. Never take a look. Sometimes people just need to get up and take a walk. Figure out the exercise that works for you. As I age, I would not be without Pilates. It helps me
I love it.
keep my dancer's body, and I go for at least a 2-mile walk a day, just to get those. And sometimes when somebody's having, I'm on the edge, I think I'm about ready to have a nervous breakdown. Examine, that is something that's thrown around, nervous breakdown. Some people do, and some people that's just a way to characterize it. What's going on with you? Getting out and walking and getting those natural endorphins going can be a tremendous help. But sometimes the issue is more complicated. So be curious about yourself, be a lifelong learner, and be educated and surround yourself and test it out. You might you might be told that this product is the best thing since sliced bread. You take it and it works wonderful for you, or it doesn't work wonderful for you. Be curious, ask questions, get a mentor, be with people that are healthy.
Yep.
Yeah.
I had my Pilates class this morning, by the way, right before this.
I just want to ask, we want to respect your time because we know you have another appointment to get to in a few minutes. Just very quickly, you mentioned earlier gratitude, and it got me thinking, so have you found that when people are more grateful and more positive, basically, have you seen that this actually down the road impacts their mental health? Has there been any way to measure that? Or
Absolutely. There are a few studies, and people are doing some work. I have a little gratitude journal, and that seems kind of woo woo, but it's not. It's basically changing your mindset. I mean, I can get as grumpy as the next person on some of the things that have happened in this world and what's going on, and sometimes you just say, what? Uh, but that can get you in a negative mindset. And then your negativity affects all those around you. And sometimes you just need to go in the bathroom and count to 10. But having a gratitude journal, just something that you write, even 2 minutes a night or in the morning, uh, is, yesterday was a bad day, and I don't find that I'm grateful for anything right now. And then you breathe on that and say, wait a minute, I've got a great friend, or maybe your friend has passed away, maybe your parents have passed away, maybe you've had some things happen. Find the gratefulness in what you've been given and take from that.
Yeah, it's a spiritual practice, isn't it?
It's a spiritual practice, and whether, no matter what religion you subscribe to or what your spiritual practice is, it doesn't matter. Everyone can practice the art of gratitude, because when you're grateful, even in the midst of a hard lesson that you may be learning, when you're grateful, then you turn and you help other people, and you help the light in your life come up. And that's hard sometimes in this world, but you have to do it. and you have to constantly reframe. Living in that light is difficult. And we see people that we think, oh, how did Mahatma Gandhi or Mother Teresa, or they must have lived in that ever. They were human. I can tell you, it was a challenge.
Yeah.
Well,
we have to constantly rethink.
yeah, absolutely. This
Yeah.
area is a beautiful place to bring this to a close, ending with the light and the gratitude. It's perfect. You've covered so many wonderful things about taking care of our own mental health. So, Dr. Gina Firman Nikkel, thank you so much for joining us today. I hope you've all gained some value from her expertise about mental health. We'd just like to let you know that we work with a natural technology that can support one's journey in staying healthy and keeping your mind fit and active, and hopefully preventing mental health issues later down the road. And also, if you'd like to engage with Dr. Nikkel and ask her any questions, we'd be happy to connect you with her. Just drop something in the chat or in the comments section here, and we'd be happy to connect you. Thank you so much for joining us today, Gina, and look for these chats periodically on our Facebook page, Activate and Thrive. We thank you for joining us, and
Thank you,
Gina.
everyone.
Thank you, Gina.
Thank you, Don and Mia. Love you.
Love you too.
Bye.